welcome everybody. Tonight's webinar is Benefits and Entitlements, Accessing Healthcare, Home Care, and Community-Based Services. On our agenda today, this is going to be kind of like an overview of the different benefits and entitlements that are available, and also where to go to get those benefits and more information if necessary. So this is sort of like a bird's eye view. With the deeper dive is there will be resources for you to be able to take a deeper dive into any of these. So this is just a very basic introductory kind of format for understanding what's available. So first, we're going to talk about Medicare. That's probably basic, and most people over 65 should know all of these things. The different types of home care. There's a lot of different types that we will review. I'm going to go over caregiver support services. We'll talk about personal emergency systems, other means of financial assistance, housing, and transportation assistance. Hold on, I have to move this. Okay. So in terms of Medicare, which I'm sure many people are familiar with. So Medicare has 4 parts: Part A, Part B, Part C, and Part D. Part A covers the hospitalizations. Part B covers outpatient care. Part C, not everybody has. That's Medicare Advantage, which is sort of like an all-in-one Medicare plan. And there are certain, I guess, discounts that might be available. It might be at a discounted rate instead of having to pay for a costly Medigap plan, which I will get to. And then there's Part D, which is prescription drug coverage. It happens to be right now, we are in the open enrollment period for Medicare. So it is important for everybody to kind of review, what is your plan? What do they cover? Do you need different types of coverage or other services to be covered that your plan is not covering? And to make those adjustments as needed. So I mentioned Medigap, which is actually not part of the 4 parts. Medicare covers 80% of outpatient costs. So in Part B, they're only covering 80%. There's another 20%, which I guess, people can decide to cover on their own, but there are Medigap plans that are private and they cover the 20%. So a lot of times, like, people will have, an Aetna plan or United, a United Health plan or something along those lines. A lot of them are through AARP, and that covers the 20%. Just something that helps people navigate through open enrollment period, or really any time. New York City Aging, which is the New York City Department for the Aging, has a program called HICAP. And this is an insurance navigation program. I have the number here. I highly recommend, if you have questions about your coverage, about what other coverage you might want to get or access, give them a call. They'll review what coverage you have and where you can, which plans can give you better coverage, and help you weigh all of your options. And now is really the time to review that, because we're in open enrollment season. So one thing that, if you're here, you probably know this, but you might not, because I find a lot of people, especially in the beginning of their dementia journey, they think that, oh, well, I don't really have to worry so much about home care because Medicare covers it. Medicare does not cover long-term care. So even if they do cover home care, it's for acute care reasons. So basically, the way it kind of works is that after a hospitalization, which means that a person has been in the hospital for more than 3 days, then this kind of can kick in as a benefit from Medicare that a person can qualify for home care. For people who are less than 3 days, a lot of times those hospital stays are considered observation. They do not qualify for home care, even, if they were in the hospital. To get Medicare covered home care, you have to have a qualifying skilled nursing need, which is some stuff that, as I've written, it's like wound care, physical therapy, speech and occupational therapy. All of those things are considered a skilled nursing need, and that would help a person be qualified for additional home health aid services. Medicare covers up to 90 days of these services after hospitalization. What I have found in my experience, most often people do not get 90 days in a lump sum. They'll maybe get a few weeks of home care for maybe 2 or 3 weeks and a few days a week. So it's not something that you can really rely on very robustly. What I also have noticed in the course of my work with people is that it is very helpful to have a working relationship with your doctor. A lot of times doctors, if they know you, if they're able to extend themselves a little bit, they may find another reason to extend the home care through Medicare, because they can find another medical reason once it's in place. So that is something that I will often tell people. Well, if you have a good relationship with your doctor, why don't you talk to them and see what if they can order a home care service, home care services for some sort of a diagnosis. So other types of home care, and these are the typical types of home care for long-term care. So you have private pay home care. That's probably the easiest. It's also the most expensive. So you have basic home care agencies, and then word of mouth, people who, you might be people who through the community, or that might be, on their own, private people who will do this type of work. Department for the Aging has a home care program. It's called ISEP, Expanded In-Home Service for the Elderly. I will get to that in my next slide. They also provide caregiver respite, which is more of it's also short term. It's a short-term break. And then the last but not least, to really get full, robust coverage for long-term home care, Medicaid is really the way to go. And Medicaid has several different pathways, I guess, to home care. The most common one is through managed long-term care, or MLTC. It's sort of like an HMO overseeing the home care. There's also consumer-directed personal assistance program. For that, you would have to have managed long-term care. And that is a program where you can actually choose to have a family member or someone be your home aide instead of having it come from an agency. Then they also have the Nursing Home Transition and Diversion Program, otherwise known as NHTD. And this is a Medicaid waiver program that tends to provide more hours than the average MLTC program. The idea being that it's nursing home transition and diversion. So if it's transition and diversion, then they're basically going to the government and saying, hey, it's a lot cheaper for me to be home with somebody overseeing my care for 12 or 24 hours a day than for you to be paying for a day in a nursing home. And so the idea is it's cost effective. And so you tend to get more robust coverage in terms of hours through the NHTD waiver program. So as I mentioned, through Department for the Aging, so there are a lot of services. I'm going to be mentioning a lot of Department for the Aging services. So ISEP is Expanded In-Home Services for the Elderly. This is provided through their case management or Meals on Wheels programs. If somebody is receiving Medicaid, they are not eligible. This is really probably good for people who maybe need a few days a week of home care. I think it's up to 20 hours or so of home care a week. And the recipient, and this is also for recipients that are self-directing and safe in their homes independently. There is a cost share to clients, so it's subsidized. It's based on a sliding scale based on income. So for people who are especially like in the middle to low income range, it can be very, very helpful because it is subsidized. For those in higher incomes, it may be just the same as going to any old agency. So it may not be worth it for people in that range, but this is an important program to know about. As I mentioned, doesn't provide more than 20 hours a week. And often there are often waiting lists, and fairly long waiting lists. So you got to expect that you're going to have to wait a few months before you'll be able to get the service if you're just starting out with it. In terms of their caregiver respite program, so this is a program that's designed to provide a short-term break for the caregiver. The amounts vary by the program, but it's usually maybe like a day or two a week, or a day or two every other week. It depends on the funding. It's not a lot. The idea is that it's supposed to be a short-term break, so the caregiver can use this time to go and run an errand, or to go and, I think that the one that they probably like the most is to go and get a pedicure or something along those lines, but to do something for themselves. The caregiver respite can be both in home, so they can have a home, home aide, or in a congregate setting, like an adult day program. So somebody can say, hey, I'd like to go to this social adult day program. Can you cover it through the respite program? And they should be able to do that. And ideally, it's used when the person's in the process of applying for Medicaid, because there also needs to be some sort of a plan in place for what's going to happen once these services end. So a lot of times people will start their application for Medicaid, ask the caregiver respite program for some respite help, and get it that way. If you're interested in any of these programs and any of the other Department for the Aging programs I'm going to mention, the number is on the bottom of the page, 212-244-6469, or you can call 311, or when we send these out, you can click on that link and get all of the information that you need. So another thing I do want to mention, because this is another thing that many people come across when they're talking about getting long-term care and home care, is long-term care policies. So many people have long-term care policies. There's no real uniformity to them. They vary by provider. This is just in my experience. It's very important to read the fine print of the policy. Some of them are very robust, others are less so, because when long-term care policies first started, I guess people weren't expecting that it was going to be quite as costly as it is. So a lot of times it can be very difficult to actually get coverage through long-term care. They make you jump through some hoops. Such as most policies have a 30 to 90-day deductible, which means you have to cover the cost of the first 30 to 90 days of service. It also, long-term care policies need to be activated. So you have to call the long-term care policy. They come to your house and assess the holder to determine if they qualify for services. So they're going to look for, how impaired are they in terms of attention to of activities of daily living? Are they able to dress themselves? Are they able to feed themselves? Are they able to walk? Are they able, do they have dementia? Those are all going to be questions that they're going to be asking. Depending on the policy, as I mentioned, some policies are more robust than others, but some will cover home care, adult day programs, assisted livings, nursing homes, and geriatric care managers. And a lot of times they can be time limited. So, they're not going to necessarily be doing this for the person's whole lifetime. It's only going to be a certain amount of time or a certain monetary amount. And these terms vary based on the policy. So if you do have long-term care, a long-term care policy, I highly recommend just go over the fine print and what the terms are, so you know. So as I mentioned, Medicaid really is the avenue, especially in New York, to cover the long-term care for people almost indefinitely. So the other thing to keep in mind that it can also be used to cover that 20% of healthcare costs that I mentioned. So it can be used as a Medigap program as well. For Medicaid, there are income and asset limits. So, you have to be mindful of that. Another thing to be mindful of, though, is because a lot of people say, oh, I don't qualify. Older adults over 65 and people with qualifying illnesses can be eligible. So for many people who have dementia, this is really the way to go. What ultimately can happen is that if a person's income, which is I think like a little over $1,700 a month, let's say somebody has an income that exceeds that, they can put the excess income into something called a pooled income trust. These trusts are community organizations that are pooling people's surplus money, above the Medicaid limit into a big pool, a big trust. And you can basically submit the person's bills to the trust. The trust will pay their money. They'll pay their bills with the money that's in the trust under their name. And so they're basically keeping their income for the most part with a little bit of a service fee taken, but for the most part, the person is keeping their money. It's not in their pocket, so it's not considered theirs, but they're not losing all of their money or all of their income with this mechanism. There are also asset trusts and life estates. These are things have to be consulted with an elder law attorney. That's where our legal and financial webinar comes in handy. And so I recommend, if you have questions about that, to go to one of those seminars that we have on legal and financial or Medicaid. Those are run by attorneys in the community, and they can answer those questions very, very well. So as I mentioned, just a little bit more, managed long-term care is the most common Medicaid program. This plan determines home care hours and provides home health aides through an agency. You do have to have a demonstration of medical need. It's hard to get 24-hour care, and it is not split shift. Here, through managed long-term care, you're going to be hearing, oh, well, we don't provide babysitting. So it's really going to be very medically based. Does the person have medical criteria that, will qualify them? Are they unable to provide their daily care? Are they having difficulty with ambulation, with moving? Do they have difficulty with showering? Do they have difficulty feeding themselves? Like, these are all things that are going to be looked at the MLTC level. And under the MLTC, you have consumer-directed personal care, as I've mentioned. Consumer-directed care is through the MLTC program. It is not through the NHTD program. But through this program, you can hire and train your own aide. It can be a relative, but not a spouse or a parent of a dependent child. One thing I do want to add, I mean, I find that there are people who find the consumer-directed the CDPAP program, very helpful and useful. What's really important to keep in mind, though, is that because you're not using an agency, you're basically staffing everything. So you have to make sure that you have something to cover when that person who is the aide is unavailable. So that's something to keep in mind. In terms of the nursing home transition and diversion program, the NHTD, that's a Medicaid waiver program, and it's designed to divert a patient from a nursing home. And a lot of times, if the person doesn't get 24-hour care, they will get 12-hour care much easier than in the managed long-term care program. I also wanted to mention one more thing about the managed long-term care. Oftentimes, it will be hard to, or they may not give you the amount of hours that you want. You are able to appeal this, and there's a process for that. So, I would keep that in mind. I was just actually talking to somebody today, and they were interested in the CDPAP program, but the MLTC was not giving them enough hours. So they were applying for the NHTD, but I basically told them that, you may want to apply for NHTD and try to appeal the determination of the MLTC and ask for more hours given the situation. And then this way you can decide which aid you want through the CDPAP program. So other things to know about that are available through Department for the Aging. It happens to be, we are very lucky in New York, especially New York City. There's a lot. There are home delivered meals and case management. There's caregiver respite, as I've mentioned, high cap, as I've mentioned. There's also some limited transportation assistance. Maybe you get, I think it's like one ride a week with a car service that you can get through there. And they also are the ones that fund all of our senior centers, and senior centers are really wonderful places to get some recreation. It's as I like saying, today's senior centers, and actually now they're called older adult centers. They're not your grandparents' senior centers. They're not sitting there only playing bingo. Many senior centers, if not all, are doing pretty high level classes, art classes, yoga, different physical activity, and it's all free. So it's highly recommended. I highly recommend it. And for more information on any of these programs, you can call New York City Aging Connect, which I have on my slides. So as far as personal emergency response systems, I didn't edit that, excuse me. So the CaringKind, before I go into the personal response systems, I want to talk a little bit about the CaringKind Wanderer Safety Program. So the CaringKind Wanderer Safety Program is a program we have with Medic Alert. They provide a titanium bracelet that is engraved on the back with the person's name. It says they're cognitively impaired, and there's a tracking number. If somebody has wandered and they have that bracelet, and they're found, let's say they're found by any emergency personnel, paramedics, firefighter, police, they actually have the Medical Alert database system right in front of them. They can look it up, punch in the ID, and get the person back to their emergency contact very quickly, and as well as in a hospital. If a person is just found by a generally Good Samaritan, then they can call up the number that's engraved on the back. There's a Medical Alert number. and they can provide the number, the ID number, and then they will give it to, they will also be able to reunite that person. The response time or the wandering time was greatly reduced by using this program. Unfortunately, it doesn't prevent wandering, but if there is a wandering incident, it's definitely a very helpful thing. If there is a wandering incident, the first 24 hours are crucial, and this really helps to make sure that the person comes home safe. It's also great because you don't have to worry about whether the person is carrying a purse or carrying their wallet or carrying whatever. It's literally on their person. It has a very hard clasp to take off. So most people cannot take it off. So it's highly recommended, at least as one tool in the wandering safety planning that we provide our clients. In terms of the actual personal emergency response systems, so we have life alert systems. I don't really have any recommendations for brands, but that's the one that I know of off the top of my head. Medicare doesn't cover these devices, and they generally cost anywhere between $25 and $40 a month. Some Medicare Advantage plans do cover them. And also a Department for the Aging may have programs that also provide assistance for these devices. So if that's something that is of interest, call 311 or Aging Connects. So in terms of financial assistance, so we have Social Security disability. This often applies for people who are unfortunately diagnosed with early onset dementia. We often get people who are faced with that who need to go on disability. So this is open to people with a qualifying disability who don't qualify for Social Security due to age, and they've worked long enough to qualify for these benefits. I have here the number that can be called and the link for people who want to apply online. Just be aware, there's a 5-month waiting period from the date that they determine when the disability began, and payments will begin on the 6th month. So it doesn't happen immediately. Also, just I don't know if this is an official thing, but I have noticed that people who do apply for Social Security disability are usually rejected the first time, and they have to reapply. So it may take a couple of times before they are actually approved for Social Security disability. There's also supplemental security income, and those are people who have little income, less than $1,500, or resources less than $2,000, and who are disabled. Again, I have that information on the slide as well. And then there's SNAP, which is the Supplemental Nutrition Assistance Program, used to be known as food stamps. And that eligibility is based on household makeup and income, which doesn't include members of over 60 because the criteria changes for households with individuals over 60. People over 60 are considered their own household, I believe. It is much more, it is not as stringent with requirements for people over 60. And I highly recommend for people who are interested in applying for SNAP to contact Live on New York's SNAP Outreach Program. They specialize in benefits outreach for older adults. In terms of housing and transportation, so for low-income housing, I know housing is often something that people will talk about a lot. So we have the New York City Housing Ambassador. You go on that page, they'll show you what's available. You'll be able to put in for lotteries through that. So that, of course, is also not something you can expect is going to happen immediately when it comes to being able to secure some housing. But for people who have time and can wait, it's a good idea to put in for the lotteries for senior housing. There's also a home sharing program through New York Foundation for Senior Citizens. And this is where, you have people who may or may not be, I believe they are older adults, and they have extra rooms or whatever, and they want to rent them out. They're vetted. It's a program that vets both the landlord and the tenant. You can call 311 or the number 212 New York for help with that program. I know like Accessoride is something also, it's great and not great at the same time for many people, but it is a very useful thing to have on hand. To apply for it, you can call 311 and they'll get that process started. They'll usually give you an application, and then you have to go down and go for a physical, and they determine whether you will be eligible for Accessoride. Other things to keep in mind with transportation assistance, there are Medicare plans that cover cab rides to and from medical appointments. And also, as I've mentioned, the Department for the Aging programs often provide assistance with transportation as well. Contact 311 or Aging Connects. And with that, I am ready for questions.